Dr. Sharma with New Life Bariatric Associates joins us now. Thank you for coming in. Today we're talking about painless and scarless surgeries that you perform. So welcome. You're one of the few doctors in the country that can do this scarless procedure, and we want to show people sort of how this has evolved with bariatric surgery. On the far left is what they call the open surgery. Now, that is how most bariatric surgery was done, what, about a decade ago, doctor, or maybe even more so?
Yeah, bariatric surgery has been there for almost 50 years.
Okay.
And it used to be very invasive. As you can see on the left side, there's a big cut. Then things changed about 15, 20 years ago. We started doing minimal invasive surgery in which you make 5 or 6 small cuts in the abdomen, pass the instruments and the camera, look at the screen, and do the whole operation. And that's what most people have been doing bariatric surgery now. In last several years, things have gone from minimal invasive to least invasive. I call it scarless and painless surgery. And on the right, you see one of my patients who had full gastric bypass, and you can't even see the incisions.
Now, what's curious to me here is how you went about doing what they call a scarless surgery, or what you call a scarless surgery. Tell us how a doctor goes about something like that.
See, what I was thinking, most people were reluctant going for surgery because it's painful and they have scars and the complications. To the basic difference of the single incision surgery is you have one cut at the belly button. And before I make that incision, I put the ultrasound on the abdomen.
Okay, now that's what we're looking at now. That's the ultrasound on the abdominal cavity.
And on the right side, you can identify a specific nerve going towards the belly button. Once you identify, you inject large amount of numbing medicine, long-acting.
Okay, now let me interrupt so we catch this. Okay, so there is a particular nerve that's going to the belly button, and then once you find that with the ultrasound, then you inject the Novocaine, or the pain medication, and the numbing ingredient.
So it's a long-acting. It makes your belly button numb for 48 hours, and many of my patients, they had 0 requirements of narcotics after major surgery.
Okay.
And then the way we make it scarless is we make the incision at the belly button. So here on the left, you see a small cut at the belly button, which is a natural scar. We put a wound protector and a cap, and then we can insert 3, 4 tiny instruments through that hole and perform even major complex reconstructive surgeries like gastric bypass. The problem was, as you can see, you are having like a chopsticks running. Technically, it's very challenging. We worked on it for few years and then started doing, I've been doing single incision gastric bypass for last 5 years, and I've performed more than 150 surgeries. It's technically challenging, and we carefully select the patients who's eligible for that surgery.
And this is something that you really have mastered, because this is, like you say, it's just not available. You have to be the right doctor to be able to take on this kind of a challenge and have the right expertise like you do.
Yes, exactly. Just because you do it, there are a few things you have to consider. It should be safe. And then after that comes the cosmesis. The reason
comes the what?
The cosmesis, looking good, less scar, and all those things.
The cosmetics.
Yes,
okay.
Yes. The reason I do this surgery is because it's painless.
Okay.
And because it's painless, the patient can start walking 1 hour after the surgery.
So there's not a lot of recuperation time with something like this.
So it has really translated to faster recovery, shorter hospital stay, early return to work, and less compromise to functioning of your heart and lungs, translating to much better recovery and more acceptable to the patients.
Now, when you generally look for patients, or patients come to you, much of this is word of mouth, as we found out. But I know you have some patients that come from other countries for your expertise here in Jacksonville.
That's true. You know, selecting this type of surgery and the surgeon is a complex procedure. and you need to find person who does all different kind of surgeries in all different approaches.
Right, and the other thing that's important too, and of all the doctors that we've had come on, the one thing I find interesting is that you want to find a doctor who performs a particular type of surgery on numerous occasions. So if you have one doctor that does it once every week versus a doctor that does like 20 or 30 a week, then you're always best to go with the doctor that has more of these under his belt, so to say, so that, you know, it's something that they're used to doing.
Exactly.
Right.
Experience does make the difference, and I've been doing exclusive bariatric surgery for almost 15 years now.
Okay, so that's great. Now, what do you tell patients in trying to select the patient? Because we only have about a minute left. What do you tell them?
Well, for single incision surgery, I talk to the patient, I want to make this surgery safe. That's my first criteria. Mm-hmm. And if they have a BMI, body mass index, less than 50, they did not have previous incision in the abdomen, I'm not anticipating too much scarring in the abdomen, then it can be an approach which can be selected. Okay. And I want to do this surgery in equal or less time compared to traditional laparoscopic surgery.
Excellent. All right. Well, that's definitely quite the feat. And like you said, people can, your recuperation time is so much quicker. It makes it all the more worth the while.
Yeah. Many times patients even think that they never had a surgery because they can feel the scar and they have no pain. So they ask me, doctor, what happened? Why did you cancel my surgery? I said, no, you will see the effects of the surgery very soon. And they find out that diabetes is gone.
I love that.
Then they trust me.
All right. Dr. Sharma, thank you as always. It's always a pleasure.